let me welcome you, Bob Snyder from the Department of Health, and Dr. Stephen Bickle, also from the Flagler County Department of Health, and to others in our community, welcome. This is the second in a series of COVID information that we're offering to the community as an initiative of the African American Cultural Society. We've been aware that there is a significant amount of vaccine hesitancy within our community, and this is our effort, along with others, to try and address that, to encourage people to access information, ask relevant questions, and make informed decisions about taking the vaccine. We're pleased that the Department of Health use AACS as a vaccination site to make certain that our community has access to the vaccine at the African American Cultural Society. So we encourage all those who are interested to come to be vaccinated for your own health and for the health of your family and our greater community. We are also asking that any who have questions, forward those questions to us. Another important aspect of our ongoing series will be the addition of Dr. Luis Allen from Advent Healthcare. Dr. Allen is a noted psychiatrist whose tenure at Advent Health now exceeds 20 years. He's well-versed in the needs of our community, and he shares our concern about the mental health ramifications of COVID-19 on our community, our seniors, our working people, our young people who are not in school. All of these have raised an additional concern in terms of our emotional health. So Dr. Luis Allen will be addressing those concerns later in this presentation and in future presentations. And with that, I'd like to turn it over to Mr. Snyder to give remarks, and then I'm sure he will turn it over to Dr. Bickle for statistical updates on COVID-19.
Thank you, Sybil.
Thank you.
You're welcome. Thank you all for being our partners in this regard. The first slide basically is an update on the number of cases here in the state of Florida. And so that's 2,104,000 cases in the state. The second slide just shows the number of cases here in Flagler County, 6,829. The third slide shows, it's a real positive slide because it shows for the first time in 5 or 6 weeks, everyone, a downward slide in the number of ER visits that are related to COVID-like symptoms. Usually for us, that translates into less hospitalizations and less problems as a result. So really happy to see that turning in the right direction. The fourth slide shows the number of people in the state of Florida who have been vaccinated, and it's been climbing pretty steadily over the last few weeks. Total people vaccinated in the state is 6,786,000. So that is great news. Here in Flagler, this would be the fifth slide, 43,074 people have received the vaccine so far to date. When you take into account total population and number of people vaccinated, Flagler County is ranked 8th out of 67 counties for percent of population vaccinated. So we are indeed making progress and headway. The health department is responsible for about 70 to 75% of all those vaccines, but we're getting a big assist from the federal pharmacy program and the state pharmacy program, where vaccines have gone out to Publix, 1 or 2 Winn-Dixies, a couple of CVS's, pharmacies, and then we are providing vaccines to our small private pharmacies like Grace Community Pharmacy over across the street from the hospital, at that medical park across the street. And we also have a couple of private pharmacies that have received the Johnson and Johnson vaccine, as well as big store retail pharmacies. About 300,000 doses went out so far of the J&J, but they haven't come to us. They've come to these big retail pharmacies. So 43,074 people in Flagler vaccinated. And then I just want to highlight just a couple of more statistics for our county. The percent of population vaccinated over the age of 65 is 75%. So we have done a great job in penetrating that very vulnerable age group, those of us, including me, over the age of 65. The percent of 60 to 64-year-olds vaccinated is climbing. That's at 52%. The percent of African Americans vaccinated has increased from where we started, right after we started the vaccines and started taking good note of this about a month ago, from 4.3% to 6.3%. Vaccine sites, gosh, guys, there are many. We're at the fairgrounds 4 days a week, where we're doing up to 750 first and second doses 4 days a week at the fairgrounds. I mentioned the pharmacies. We've been at many churches. We started at Parkview recently, St. Elizabeth Ann Seton. We've been to the Carver Gym. We've been to AME Church. I think we were there this week. We've been at the Methodist Church in Bunnell, a couple of other predominant African American churches. And we're going to be at the Seventh-day Adventist Church in a couple of weeks. Catholic Church in Flagler Beach, Santa Maria del Mar, going to be there as well. Total deaths so far, 103. So we did reach the 100 mark with respect to deaths. The positivity rate is coming down, so that's good news. And hospitalizations are down. We only had 7 people in the hospital with COVID today, and that is a big improvement from just 2 weeks ago. And the only thing squirrely that we're seeing that does concern us a little bit, I meant to share this with Dr. Bickle this morning when we talked, and that we're seeing a cluster of cases at bars and restaurants. There are several bars and restaurants and little gift shops closed in our community because we believe that as a result of Bike Week and spring break, the employees got sick and they can't work. And so that, with COVID fatigue and people being a little bit more dismissive than we'd like to see with respect to public health measures like social distancing and wearing masks, especially indoors, we are seeing these little spikes in some of our bars and restaurants and smaller little gift shops in Flagler Beach in particular. So I wanted to share that with everyone. So we still got to be careful out there. So those are my remarks, and I'll turn it over to Dr. Bickle.
All right, thanks, Bob. Bob and I talked ahead of time that we were going to mainly, we're trying to leave a lot of time for questions. So this is not going to be like the thorough overview that we did before, just kind of a few highlights. In terms of the US and in terms of Florida, in terms of case rates and deaths, if you look over the last year, what happened is in the US, in terms of cases, we had a first wave in the spring, especially in the Northeast, a lot of deaths that came from it because kind of we weren't prepared, kind of hit a lot of older people in nursing homes, high risk group. It was kind of a perfect storm, and it kind of got everybody's attention. But the number of cases was actually not that high at that time. And then there was a second wave, a lot more cases that seemed like a lot. And actually the deaths from that weren't nearly as high, partly because the group infected wasn't as old. And then there was a third wave in the fall and winter that just totally swamped anything we'd had before. People got kind of used to this massive numbers of cases and deaths. And if you look at the patterns, I mean, that wave was like a tsunami compared to the others. And since then, it's gotten a lot better, but we've kind of gotten numb to this, because if you look at the case numbers now, there, we were in the 200 to 300,000 cases a day through the winter, and now we're into the 50 to 75,000 cases a day. But that's actually the peak of the second wave numbers. So if you look compared to last summer, when we thought it was pretty bad, and now we think it's pretty good, it's not really that great in terms of cases. We're just kind of used to it. So that's one message. But there is something that's really quite. So we're still kind of concerned that there's still a lot of COVID out there. We want to put this in perspective. We don't want to be too alarmist. And there is something very different now, and that is we're much better as a medical community, as a on the government level, private level, all levels, at recognizing nursing homes are a high risk area. They've been really carefully protected in the last 6 months. Secondly, the case mix of people getting infected is much younger, and since severity is really tied to almost proportionally, even more than proportionally to age, we're seeing fewer hospitalizations and fewer deaths. And on top of that, we've got a group of highly protected elderly people now that we did not have before. So the most vulnerable group is now the most protected group. We're not totally ecstatic about 75% of the over 65 people in Flagler being vaccinated. We'd much rather it be 90. But that's still quite a significant percentage, and it's reflected. We were predicting this. These epidemiological numbers, there's something powerful about statistics, because you might see one person, something happens to, or another, but when it's thousands and millions of people, these numbers tell a story that's very consistent, because things average out. So what we're seeing is, younger people are getting infected, tend to be more active in the community because they're working or just more socially active, less concerned about COVID. They still can get sick, but it's not as frequent. And so it's hard to get their alarm bells going off in their head. But so what we paint, that picture I paint right now is, it's kind of the same in Florida as it is in the US. There's still quite a bit of COVID around, as much as there was last summer, but much less than last year. Hospitalizations are down significantly, and hopefully they're going to just continue to go down. Deaths are down. So the things we most worry about are better. And there's only reason to think that'll continue to improve. So as we get more and more people vaccinated, even the younger people, even though they're not getting in the hospital, the more of them that are become immune to COVID through vaccination, the less the spread's going to be. So we're pretty optimistic, but we're not out of the woods. We're trying to kind of balance the message to have people realize, okay, if you're vaccinated and you're 2 weeks out, you can start relaxing things, but we're not out of the woods yet. And the other thing we're trying to give messages about is herd immunity. There's a lot of misunderstanding about herd immunity. One misunderstanding is that herd immunity is like a wall, that once you hit that wall and you get over it, you're in a new world, and before that you're in the old world. And it's really not like that. It's just however many people are immune to COVID in a community, the spread goes down. So it's, if there's 30% immune, either from a vaccination or infection, the spread rate drops, that kind of range, 30%. If it's 60%, it drops even more. But that herd immunity number just means it's the number where the disease stops multiplying in a community. So in other words, it's where you can still see COVID going around, but it doesn't go from 100 people to 200 to 400 to 800 to It doesn't keep just climbing to these disastrous proportions. It kind of stays around, but it's not the threat that it used to be. So herd immunity, and the other thing about herd immunity is herd immunity is local. When you do look at population in the US herd immunity, it's a sum of all the little communities in the area. And there's some intermixing, people in Flagler may go to St. Augustine or down to Volusia. But a lot of times they stay in their own neighborhoods. And the higher percentage of people in Flagler County who become vaccinated, the more we're going to be protected locally. So we're just kind of want to keep pounding the drum about immunizations, this vaccinations, getting the younger people, getting the children in schools vaccinated, because it's going to protect all of us, not just health-wise, but also our economy, because we can get back to more, normal levels of activity. So we're pretty excited about the year going forward, but we want people to just stay. This is a war, and it's more a marathon than a sprint. And we want to keep the pressure on to the younger people who feel less vulnerable. They still can benefit a lot from the vaccine. And then there's a few other little kind of vaccine-related bits of news that I thought I'd share, and then I'd be happy to answer any kind of questions. One is, there's been some kind of exciting, it's still preliminary, but it seems like it's more than just imaginary. And that is that it looks like there's a lot of people out in the country who have what's called, post-COVID syndrome. We'll call them long haulers or long COVID. There's this, fancy medical term, chronic fatigue syndrome, myalgia encephalomyelitis. That just means there's some kind of inflammatory thing going on, seems to be triggered by the virus, and then the immune system continues to interact. And quite a few of these people are fairly compromised in either mentally, they have brain fog or a lot of fatigue, they can have shortness of breath, even to the point of like being disabled, including younger people. And there's actually more than a little, it's been noticed by a lot of people who treat a lot of COVID patients, that a substantial minority of these people get better when they're vaccinated. Looks like 20-30% of these long COVID people feel quite a bit better after vaccination. So we've been pushing vaccination on the people who've had COVID, because the vaccination rendered protection is greater than you get from just being infected. But this is another reason for those people to get vaccinated. And then the other issue is about variants and what's the story there. And that's another reason to get vaccinated, because these variants are kind of wily. They try to sneak away from, there's kind of a pressure to get better at evading antibodies and with the virus. So the viruses that can evade antibodies can go and infect more people or stick around in a person. And so there's been kind of this battle going on. The immunity that you get from getting infected with COVID is pretty substantial, but it's not permanent and it's not complete. There are a lot of cases, people getting this 6 months later, a second case. And the immune response has to do partially with how sick you got the first time. If you got sicker the first time, your immune response gets more triggered. If you had a milder infection, a lot of times your immune system didn't get that push to respond. So some of these actually people who kind of coasted through their first infection get a second infection because their immune system really didn't build up that much immunity. The vaccine kind of puts your immune system into, kind of turbocharges it. The amount of antibody you get, the amount of stimulation, it's probably maybe an order of magnitude greater than just from a natural infection. And that's particularly useful to prolong the duration of immunity, longer than just from a natural infection. We don't know that for sure yet, because we've only had the vaccines in people for 6 months. But the other thing is, if you look at antibody levels, they're much higher. And so they can kind of handle some of this resistance from these new virus variants, because the resistance is only partial. It's not like the viruses don't respond at all. It's just they're not as sensitive to these antibodies. And there's like many reasons now to get vaccinated. One, protect yourself. Two, contribute to herd immunity. 3, even if you've been infected, it gives you more protection. 4, it's better protection against the variants that are coming down the pike than you'd have otherwise. So, and then if you do are, so a few people can get infected even after they've had the vaccine. That will definitely happen. You'll read about it in the news, but they are almost exclusively going to be mild infections. Even the J&J vaccine, which doesn't look quite as effective in preventing mild infections as the Moderna, Johnson, and Pfizer, looks like it's virtually the same, like close to 100% effective in keeping people out of the hospital, which is what we really care about. So those are the important things about vaccination. There's one other thing I want to mention, if in case this ever comes up for any of you or anybody you know, and that is, if you are a high risk person for COVID, either by virtue of your age, you have diabetes, heart condition, any of the things that would make it more likely you'd have a bad outcome from COVID, and you get symptoms that suggest it, what you should do is get tested ASAP, preferably with a rapid test, to get the results right away. And if it's positive, you should go and there's ways of finding this out, but you should get yourself monoclonal antibodies. Probably what we do these days is the cocktail of antibodies, and that's because they're more effective against the variants. Advent has 2 sites in Florida that I know of that does this. One is I think New Smyrna, and the other is Orlando, but New Smyrna is the closest one. I think, I haven't checked recently, but I think they're using the cocktail because everybody's kind of switching over to that. But this is by far the most effective treatment for COVID that we have right now. If you get these antibodies within 5 days of being infected, so the time, once you have the possibility of having COVID, the clock is ticking, and you shouldn't tarry and delay to get tested. And within a day or two, if you find out you got it, get the antibodies, your chances of having a serious infection go down by like 80%. So that is a real dramatic improvement. That's kind of new, and it hasn't gotten a lot of publicity because you have to do a little work to get those antibodies. Right now, they're an intravenous infusion, so you got to go to some place that's going to give you an IV, like an infusion center. So it's not been that publicized, but it's definitely any patient of mine. That's what I'm going to have them do. Haven't had any in that category yet, but it's definitely something to keep in mind that there is, if somebody does get COVID, maybe they haven't been vaccinated for some reason, or they're a younger person, haven't gotten around to it, or just became eligible, but they've got diabetes, or they're really overweight, or hypertension, these kind of risk factors, they should get treated. Those are the younger people that can die from this. And with the monoclonal antibodies, that can be largely prevented. So that's actually the one kind of breakthrough that not a lot of people know about it. So that's kind of all the kind of topical stuff. We're Bob and I are kind of trying to balance, what do we tell people about their behaviors and getting their life back so they don't feel depressed, and the other things we're going to be hearing about later in the talk. But I think we're trying to balance that, and what we've looked at is we're kind of looking at it. There's a couple stages to this. The first stage is when we've had enough time to vaccinate every vulnerable person. Doesn't mean they'll all get vaccinated, but they'll all have had a chance to be vaccinated. So once we're like 2 weeks after that, which we think will be about the end of April, then those people are kind of protected. I think society can start, loosening up somewhat and switch to a moderate level of safety consciousness, not the extreme level anymore. And then sometime like maybe end of June, maybe end of July, the way we're going, maybe end of June, every adult who wants to be vaccinated will have had a chance to get vaccinated. So by the end of June or maybe end of July, if you're not vaccinated, it's because you didn't want to be, or you didn't try, or whatever, but it's not because it wasn't available. And at that point, I think things start shifting to society has to, not take as much responsibility for protecting everybody from getting COVID, because people can protect themselves. It doesn't mean we can't work our fannies off trying to get vaccine out in the community, reach every person, has access issues. I'm not saying we should ignore that, but I'm saying having if we've done that, then it's pretty much on the individual's level, if they didn't want it. And at that point, I think we should be pushing to open things up because there is an impact economically, health wise, educationally to having things shut down to not to prevent COVID spread. So I think there's going to be a shift. It's going to take us some getting used to. It's because it's like Bob and I are still kind of in the extreme safety protective mode, and now we're saying we got to kind of loosen up about this, so that we don't lose touch with the people who want to be more active now and or who've been vaccinated and say, well, why get vaccinated if I have to stay home all the time? And that's a good point. So we're trying to kind of balance this, work with the community, and really seek input from others on how they feel about some of these issues.
Well, you've given us an awful lot of information and an awful lot to think about. But there are a few questions that I'd like to pose to you. This is the first time I've heard about how do you say it?
Yeah, monoclonal just means they're a
Monoclonal.
specific type. They've been kind of like they've been engineered to one type of antibody that's made
Okay.
in a lab.
We will continue with that. I think Dr. Allen is with us. I think we will go on and bring him on board to speak about a concern that we have, which is the mental health of our community in the time of COVID and what the mental health ramifications have been for our seniors, our working adults, and our children who've lost time in school and who certainly are aware of what is going on. Then I'm going to come back to you if you'll stay with us. In the interim, thank you for your participation. Stay with us, and we're going to go to Dr. Luis Allen at Advent Health.
Thank you very much for the invitation, and it's good to be here. This have been the past 12 months. I felt that mental health. We were already having concerns about the awareness of mental health, the lack of access to mental health, and then came COVID, that I felt that to some degree have pushed this up in an exponential way. And I wanted to, over the next few minutes, just review a few items as it relates to COVID-19 and our mental health. So I before we start, because I often feel that we try to make that disconnect between what's happening on our body from the neck down and then from head up. And really, even the World Health Organization has defined that there is no health without mental health. And the COVID-19 journey has also been a very good example of that, that we were from the beginning, and once the understanding was there, drilling about that you should wear a mask, wash your hands 6 feet apart, and everyone was very diligent about it, but we were not hearing too much about how to protect your mental health, how to keep your mental health healthy. And it's very important for us to realize that yes, there is no health without mental health. It's one person. Just some additional number that 1 in 5 adults experience some form of mental illness, and often we just think of the person who is having severe, what we'll define it maybe as a meltdown or detached from reality. But sometimes some of these symptoms can be manifested in ways that we don't realize that are part of the mental health condition. And it can be just headaches, abdominal pain, sometimes in extreme cases, chest pain. Most of the work that I do is in hospital setting. I've been with Advent Health for over 20 years, and I provide, in fact, in Flagler County, I provide the mental health services along with two other psychiatrists there
Hmm.
at the Advent Health Hospital. So we realize that often we will get called for consults that are not necessarily of someone just feeling sad or having problems with anxiety, but sometimes certain physical manifestations are part of stress, and it's part of a mental condition that needs to be addressed in order to obtain relief of those symptoms. But I think you also realize that there is a lot of misinformation out there, and that's the reason it's important for us to be able to talk about these things. And the information is power, information is what is going to help us to come out ahead of this very difficult 12 months that we have dealt with. We can see the finish line, and yes, things are definitely getting better, but we're not at the finish line yet. So it's very important for us not to let our guards down. And dealing with this virus, we realize that the psychological impact of having something that I think in the beginning, for some, might have felt that they were just fighting with a ghost. We did not know where it came from exactly, what is happening, how do you protect yourself. And over a period of months, there was more information that was available, and we kind of learned to adapt and live with this. But it was very anxiety provoking in the beginning because we just did not understand this condition. And there was often even stigma attached to contracting the virus. These are some of the information that is coming out, but it's very preliminary. But I think as the months go by, we will be learning more about it. That 1 in 5 COVID-19 patients will be diagnosed with mental illness within the 3 months of receiving a positive diagnosis. So it is there. And I want to pause now and say that I know we look at COVID and look at those that probably had the illness, the condition, but then we look at the others that did not contract the virus and said, okay, these individuals did not suffer from this pandemic. But the mental health part of it is really, if even if you did not contract this virus, the mental health aspect could also could have had an impact on us. And that's the reason why it is very important to try to identify what are some of those early signs that we are experiencing when, and that you should be concerned about, or that we should be concerned about. The impact of COVID-19 in behavioral health. And this I've seen, I do a lot of work with emergency rooms. And this is what I've seen in terms of with the number one and the number two that we're seeing with COVID-19. There has been a significant increase in anxiety disorders. And I think each one of us have experienced some form of it in terms of that additional stress and anxiety of every day trying to do the right thing, trying to protect ourselves. And it's okay when you're having to deal with this for 1 or 2 days. Probably it's not as okay dealing with it for weeks. Well, guess what? We have been dealing with this now for 12 months. So you can imagine the toll this have had on our bodies, the toll that this have had on our minds, even if we did not contract the virus. The other part is that because of seeing more problems with anxiety, for some, they have tried to look at unhealthy ways of coping. And one of those is by the use of alcohol, and we have seen an increase in alcohol consumption during this time because it has been a way of how to cope with some of these anxiety disorders. So, what are some of those symptoms that we should all be mindful of? Because this is one we cannot be talking about it, and I cannot be talking about it, and don't feel that I am at risk. We are all at risk of developing these condition, and one it's very important that if you're noticing that there are changes with sleeping habits, and we have the difficulty falling asleep, waking up during the night, or early morning awakening, it's very important to consider that these might be your first sign that something is not right. If we're not sleeping that well and it's not corrected over a period of a few days, then everything else can spiral down in terms of symptoms of anxiety, depression, and just difficulty with our overall cognitive function. We cannot be as sharp as we would like to be. Changes in mood, very erratic, very fast. It's very important also to look at that this could be a sign that there is something more happening. Just cannot get motivated. We mentioned the anxiety, changes in eating habit, be it up or down. And then, as we mentioned earlier, if there is that increased desire of alcohol consumption, just to try to feel normal, to try to just feel even, these are all symptoms of a underlying problem. And we'll say, okay, this is happening. I can stay to myself. It's not going to affect anyone. But if we are out there in the workforce and at this point, even at home, working from home, how does this affect my work? It definitely impacts on our productivity. We're not as engaged. Our interaction with our coworkers, the quality that gets affected, and there is that decrease in that physical capability that could be happening with this. So some of the items that we probably need to be very mindful of, and it's important to follow these, is that to try to establish a structured routine. And this is primarily in this era of working from home, where it's things can be a little bit unstructured, a little bit more difficult to kind of keep a routine, but it's very important to keep a structured routine, remain cognitively active. This is a consequence of the past 12 months, and in particular with long-term care facilities, nursing homes, or assisted living that did not allow visitors for so long because it was very important for everyone to remain symptom free, virus free. But what happened in the process is that it did affect some level of cognition. And it's very important that we try to do things in our day to day, be it reading, anything that you feel that helps to stimulate our thinking. Exercise, it's and I know it might sound very basic, but it's also, these are the steps that will help us address some of those symptoms. And even with the exercise, I often give the example that if you go to Publix, and I know we're always trying to search for that spot that is as closer to the building as possible, maybe just a small change, just trying to look for that spot that is further away. In that way, we can increase some of our physical activity. And I've mentioned now as I mentioned before, they avoid the use of alcohol to treat the anxiety or boredom. And it's important also to be familiar with your community resources. The good thing is that now we have a virtual community. So they are here in Central Florida. There is the Mental Health Association of Central Florida. They have a lot of resources when it comes to understanding this or better understanding of this condition. And I would just like to end with saying that definitely there is a great need. But before we can address the need, there must be an awareness. And how can we impact on that awareness is by trying to understand those symptoms that I mentioned earlier. As soon as someone is starting to experience these symptoms, be it yourself or a loved one or a coworker or a friend, is to make sure that we are encouraging them to seek help. It's very important. And what I often explain to my patients is that the earlier the intervention, the shorter the treatment. The longer we wait for treatment, then the longer it's the treatment. So early intervention is very important. And I'm hoping that, yes, we kind of look and be very introspective to ourselves if we need it, or if we find that there is a family member that needs it, or if we have a friend or a coworker that needs it, just share with them and encourage them to seek help, because what we dealt with in the past 12 months, I'm sure no one has actually dealt with something worldwide like this before in their lifetime, and we have to give ourselves room to understand that it's okay to feel the way that you're feeling, and that it's also okay to get that help that you need to address these symptoms now in these times. So that's kind of a summary of what I wanted to share with you.
Dr. Allen, I can't tell you how important the news that you shared today is. I'm certain that there are any number of people within our membership and within our community who are experiencing these symptoms of mental health crisis. And it's so important that you are with us and that you give light to this. I know there will be any number of questions that will result from this as we film and as we go forward with you as a regular participant. But I wanted to ask you, as with so many other conditions that affect the African American, Black, Brown, Latino community, are we more susceptible to these kinds of emotional downturns as a result of COVID? Are we predispositioned for this?
Well, that's a very important question, because the when we talk about COVID-19, that the minority community was at higher risk. If they are at higher risk, then they are at higher risk of developing psychiatric condition, mental health condition. And what happened is that, and for us, it's very difficult that even there is treatment available, there are resources, but then if we're not accessing the resources, it just compounds the problem even more. And I know that there is so much stigma and barrier with mental health, and we have to try to carry that message every opportunity that we have. I completed last year, I did I like running. So I did a marathon in every continent in 7 days. And the reason that I did that was to raise awareness of mental health. And it was with the Mental Health Association. So we have to take every opportunity to raise that awareness, because we could be suffering from it, loved ones could be suffering from it, the people that we get in contact with. And it's sad that the tools are there and to help us, but we are not accessing it. So it's, yes, we are at a disadvantage with that, but it's very important that we can share the word that there is treatment options that are available.
Dr. Allen, on behalf of our president, Joe Matthews, and our board of directors, uh, Ed Pinto, I know that they're going to invite you to have a part in our initiative here and to bring this information to the greater community, particularly how we resource or access these resources. So
Yes.
going forward, off screen and at another occasion, we will speak with you about developing slides that will give people access to where these resources
Mhm.
exist
Yeah.
so they can follow up on their own. And then there will be pointed questions, I'm sure, that will be asked of you in terms of how we see our young people, how we recognize emotional downturns in our kids,
Mhm.
and what we do to address that, and where the resources exist with the Board of Education or other resources that can speak to our young people, our teens, our preteens,
Yeah.
and to address those questions. So I'm going to thank you very much. But one last question. Do you have slides that are available in other languages, specifically to our Spanish community,
Yeah.
our Latin Spanish speaking community, the Portuguese community? We have a significant Russian community in Palm Coast.
Yeah.
Do we have information that can be available in other languages that can be distributed through this site as well?
Well, the Spanish, I have those are readily available because that's my second language is Spanish.
Wonderful.
Yes, the others I would have to work on. And yes, I realized in doing work at the Advent Health in Palm Coast that yes, you do have a large Russian community because of patients and staff. So yes, I was surprised at that. But yes, we will have to work on those others. But the Spanish, I can provide those because we do have those already.
Okay, I'm going to ask, I'll call on one participant, Mrs. White.
Yes.
Mrs. White, do you have a question for Dr. Allen?
One of the questions that I have for Dr. Allen, I know that there were funds allocated through President Biden COVID plan. Are those funds, because I know a lot of times, and every people always try to politicize things, and this is going from state to state. Would those funds be put aside to help people that are going through mental stress, mental illness, especially if they don't have health care? How are you going to be able to get to that vast population of people that actually need this help?
I know that when it comes to the funding, the community mental health centers, and in particular, I live in Orange, Orange Seminole, Osceola. I'm close to those, and there has been some, but it's very limited funding as it relates to be able to provide services from the outpatient standpoint, and also for patients that are being admitted that require mental health that are also COVID positive, but
Mhm.
it's very limited.
Yes, it's very challenging too. Yes. Yeah.
I thank
Thank
you
you.
so much for that question, Mrs. White.
You're so welcome.
Dr. Bickle, before we close out, because we have committed to keeping this to a reasonable time, meaning 60 minutes, we'll be moving in subsequent sessions to additional questions and answers. But while we have you, there were a couple of questions that were called in to me. Among them are, will this disease be with us for the foreseeable future?
Yes, probably. It may change, but I don't think it's going away completely anytime soon. It may
Okay.
change a lot in the next year. It could be just a background kind of noise, but hard to predict. I doubt if it'll be gone.
Mhm.
Okay. Will booster shots be necessary for each of the vaccines that are currently available?
Very hard to say. Very hard to say. There are two reasons why we might need boosters. One is if enough of the variants that really are resistant to the vaccines emerge, or they become the prevalent strains in the community, that could change it. And the other is, does the immunity from the vaccine immunization itself wane over time? And hard to predict. Uh, so far it looks like the vaccine immunity may last a while. So
Mm.
at this point, the drug companies are researching this, and they will be ready. They've been talking about boosters that may be a combination of half of the original vaccine and then half of a modified vaccine that would target the newer variants. But that's just kind of being, played with in the labs right now. I don't think there are any studies even going on about it yet.
Okay. And lastly, are we all unwitting participants in experimental trials?
Experimental trials of the vaccines, or or
Yes.
Mother Nature, or COVID.
No,
Um,
all of it, all of the above.
we're definitely unwitting experimental subjects in the trial of life. But in terms of the vaccines, I don't think so. I mean, people sort of philosophize about these vaccines, but we've been in a medical emergency with the pandemic, with thousands of people dying a day. Like, we're in a war, and the people are dying on the battlefield. And these vaccines have come along to dramatically change the course of this battle. And, it may turn out there's some negative side effects down the line but we chose to take, we're sort of choosing to take this risk. I think the risk's pretty small compared to the benefits. So, and I don't think, I mean, look at the uptake rate of the vaccines among, scientists, virologists, medical doctors, people who know a lot about these risks, and they're not worried about it. I definitely don't think the community's being toyed with in terms of experimentation. We're all kind of in an experiment to see what benefit we get. Are there any harms? But so far it's looking like a pretty good experiment for
Thank
us.
you for that.
Sybil, if I may, real quick, we've given shots to 43,000 people in Flagler County alone, and we don't have one piece of evidence or of any case or situation where someone had a real serious, negative reaction that was significant to getting the vaccine. So we truly believe that they are very safe and effective and doing a great job.
I want to thank each and every one of our participants today, Bob Snyder, Dr. Bickle, Dr. Allen, and others. Thank you so much for this information. It's vital that we have it and that we distribute it. We look forward to seeing you the next time.